This is the story. In fact, it's the first chapter of a long story, I think. And I'd like you to focus on podiatry assistants. This is what this is about. Acknowledging the team members. This is a story of collaboration between university, collaboration with industry partners, collaboration with people who are courageous enough to try something new. So myself and Associate Professor Kerry Evans from Healthier led this project, but I'd like to acknowledge the partners from Healthier, Dean Hartley, Craig Page, Rebecca Gilroy, my colleague Kirsty Van Grinsven, who's a podiatry academic at Charles Sturt. Three very brave students. These people at the bottom, Sharon Denise, Chantel Annette, Jacqueline Robinson, all employed as podiatry assistants in practice. And then Jordan Duffy, Chris Annette were two of their podiatry supervisors. So the purpose of this program, developing this program in partnership with Healthier, was to address the problems with podiatry enrolments, to enable a pathway for people to come in without committing to a 4-year Bachelor of Podiatric Medicine, which is really quite daunting for people, saying, well, actually, you know, you can come in, you can do this undergraduate certificate, and what it's proven is that this gives people confidence to then consider podiatry as a career move. So it was looking at the sustainability of the podiatry workforce led us to develop the undergraduate certificate in foot health. So this is 4 subjects from the first year of our Bachelor of Podiatric Medicine, the same subjects that the students do when they're studying podiatry, which gives people confidence of that sort of level. It's a university program. And the students study online, and they come to campus 3 times during the year. They come to campus for 2 anatomy modules. We have an on-campus laboratory, and then they come to campus to do that podiatry subject where we've got that sort of summative assessment. By the time they've done this undergraduate certificate, they're really skilled up as very effective podiatry assistants. And interestingly, those 3 people who took it last year, they're all enrolled in podiatry now. So really, you know, a laudable mechanism to get people engaged in podiatry. So our project then was as a narrative study, looking at the perspective of all of us as different stakeholders there. What's the value of this traineeship model to educate podiatry assistants, career development and pathway into podiatry as a career. The methodology was a narrative methodology. You know who the participants are. We were all together on that slide there. Everybody contributed a brief narrative statement to you know, explain their perspective on their experience, and then we held focus groups, so everybody participated in a focus group. Kerry and I did coding independently and then together to inform a thematic analysis. And these are the 4 themes. We actually had 98 codes, condensed down to 22 sub-themes, and ended up with 4 themes. It's quite a long process. And I invite, because I'm here on speaking on behalf of a team, I invited people to do some little audio snips for you. So, and not all of the quotes are audio covered, I'll read the ones that aren't. But this first theme about enabling aspiration and opportunity for personal growth and career development was a really strong theme that came through.
Podiatry and foot health in general is an area I've always been interested in, and I have wanted to take up study in this area, but had always hesitated, mainly because I didn't really know what to expect, or if I would be able to keep up with study whilst working and being a mum.
I think that's a really powerful quote. You know, that really uncertainty, can I do it? This gave the opportunity for the student to take that on, take that leap of faith. This was a quote from a different student talking about being able to give back to community because they can stay in community, they don't have to relocate to Albury, they can stay and work and gain that practice experience with their supervisor in the practice in their home environment. This was a quote from an industry partner about enabling people to progress in different areas, you know, enabling a podiatry admin person to become a podiatry assistant, also enabling a podiatry supervisor to become a podiatry educator. So really you've got some real enabling factors here. And we've got another quote.
The skills that you've gained by being able to mentor someone, You're not just a podiatrist now, you're a podiatry educator.
And you know, from an industry perspective of building those potential career pathways in industry, that's another area that people might want to move into. So the second theme there, looking at enabling an accessible pathway. Michelle talked to barriers, you know, for podiatry students, offering something that's accessible and inclusive. And from my perspective, it's really about enabling equity of access to pathways for podiatry assistants or you know, into podiatry. And then we've got, who have we got here?
I enjoy the flexibility of the course delivery and the convenience of learning in a clinic where I'm already employed. It has been a huge asset to me and my family, as it was possible to study much of the course locally. The duration of the course is achievable, and it allows the student to obtain a taste for the podiatry profession without a 4-year commitment.
So again,
So I found from a lecturer point of view, the discussion was so rich because you could bring in those clinical experiences. It was deeper thinking, more critical thinking. I think the whole class really elevated their conversation because the students were bringing in their industry experience.
and I can tell you that's my colleague. These students, these podiatry admin people becoming a podiatry assistants outshone our classic first year podiatry students.
It's really great to consider people within our organisation as being able to add value in different ways. For admin team members, for example, to build their skills and ability to contribute to delivering care in a more direct or meaningful way.
So building capacity in industry. And then the last one about making an authentic contribution to podiatry practice and patient care. And the first couple of quotes are from the podiatry supervisors, so they're sort of the practice owners.
We do the odd emergency thing if someone's got something urgent, but taking on new regulars, we haven't been doing it for a long time just because I don't have the capacity. A lot of the waiting list are low risk, regular routine foot care and assessments, reports back to the doctor and routine diabetic foot checks.
You know, there's a lot of opportunity for podiatry assistants to be picking up this routine work.
There's value in having someone. She's helping me with my neurovascular assessments and providing education to a community that needs help in preventing ulcers and diabetic wounds, helping in how we take the foot in plantar fasciitis and describing what that is and how we can address it before it becomes a bigger problem. She's helping with health promotion in our community, and that adds value and time. It makes my books easier in the long term.
So challenging our thinking about what a podiatry assistant can do. You know, a podiatry assistant really can change a practice. A student's point there about their role in educating the public about the value of a podiatry assistant.
Podiatry assistants can monitor changes, and if changes occur, they'll see a podiatrist quicker rather than being someone lost in the community that's on a 6-month waiting list. Better health outcomes in the long run, less foot problems.
You know, and addressing these long waiting lists that people have, particularly in the regional areas. And just the final point here about enabling change and advocacy, because we're all responsible for advocating in this
Talk
space.
is around that the podiatrist's wife is doing some work in the clinic.
Now that was a true quote. That Chantel's doing a lot of advocacy in the Shepparton area.
Getting out there to podiatrists is a really big thing. There's actually no risk. 10 years time, this is going to be the thing that you do. But right now, how do we let people know that this is a great idea?
And this point from an industry partner, we have to keep podiatry relevant. We have to keep it moving. It's so different to the last sort of few decades.
Yeah, there's definitely a lot of advocacy work that we really need to be doing with key stakeholders, private health insurers, TPA, workers' comp. We really need to be working hard. Funding is going to be a real issue. If we can't charge people appropriately, then we really can't pay wages appropriately. So it's advocacy at all levels, my vote.
And I don't think...
So I think by turning things slightly, changing the scope of practice and changing the patient mix, we're elevating someone who's an allied health assistant, and we're also elevating the podiatrist within the profession. then the podiatrist is seeing the things we learnt at university, the things we learnt in surgery and podiatric medicine.
And I think Ms. Craig has had to rush off, but at that point about enabling full scope of practice, reducing the risk of burnout for podiatrists by allowing them to work to full scope of practice. So there's a lot more to do. I said this was the first chapter of a story, but we are actually progressing this now. If you need to talk to me later, I won't hold you up now. I've got a frequently asked questions with me because we're using this model for the whole program. The Bachelor of Podiatric Medicine is becoming a hybrid program, really enabling access. So I'd like to thank you all for staying here. A lovely little thank you from our first cohort.
Questions for Caroline? What's the cost of the certificate to the students? Is it a HEX model of fee?
It's all HEX, so it's just a standard cost for it. I think an 8-point subject is about $1,500, but they can HEX. You can catch me at the break if you want. You want to?
And I believe that Caroline has a FAQ as well. So, so last but not least, we can all